any sunscreen is better than no sunscreen. A lot of the study and data today says not using sunscreen has more health risk than using a sunscreen. And a lot of these people who are shouting sunscreen is bad for you, who are they? Are they doctors? No. Everybody claims SPF 100, 70, 50, 40, 30. The minimum SPF I say is
I think we are worried about the single kid that we have and what's the nutrition like, what's their skin like. Should parents consider taking to their dermatologist in the early teen years?
Today, teenagers are like mini adults in many ways. When the transition's happening, right, from 10 to 12, that aged gap, when you start seeing the initial signs of acne, that's the best time to bring your skin in to see a skin doctor. I'm not saying this because I'm a dermatologist. I'm saying that because you want to get the foundation right.
A lot of people are getting into these Korean skincare brands. Is this really that the Korean skin and the Indian skin is the same thing?
8-step, 10-step, 12-step skincare. I'm like, wow, look, Korean skincare is good. There's no doubt about it. But it's for Korean skin type. Both skins act completely different. But all you need is actually a 3-step routine. First,
Your skin is your body's first line of defense and the largest breathing organ you own. Yet, we often don't give it the care it deserves. That's where Dr. Chytra comes in. I trust my skin with her, like so many others who have worked with her. She's not just a doctor, she's the boss. When it comes to skin, disciplined, sharp, and brutally honest, expecting her patients to put in the same effort she does. Founder of Cosmoderma Clinics and a global expert in aesthetic medicine, in this episode we cover exosomes, regenerative treatments, sunscreens that actually work, the 3-step skincare routine, AM and PM rituals, acne, aging, pigmentation, and real skin hacks. You want to watch this episode because the skin is your largest organ and Dr. Chytra will help you take care of it. So, without further ado, let's dive in with the beauty doc herself, Dr. Chytra V Anand. Dear Lord, thank you for today. Thank you for a wonderful weather in Bangalore. And Dr. Chytra is a good old friend gracing this studio today. Bless her and her family and everyone in her ecosystem. A big thank you to all the people in my family and my team, everyone out here. Thank you for making all of this happen. Good Lord. Let's rock and roll. Dr. Chytra, it's so good to see you. I know that you globetrot the world and I tend to see you at your clinic every now and then. You take care of my skin. Now, I don't claim to have the best skin because I went through all the teenage problems that everyone had. I wasn't a nutritionist as a teenager. And I don't think my parents had an idea about the science of dermatology. They didn't even know that a doctor existed maybe in skin because I think, correct me if I'm wrong, in the olden days, we just thought about tuberculosis as some of the diseases that you did, or herpes or shingles or something like that. But anyway, my question to you is, and because you have a young son, how old is he?
8.
8, and I have a 12-year-old. I think we are worried about the single kid that we have and what's their nutrition like, what's their skin like, what's their behavior like. So should parents consider taking to their dermatologist in the early teen years, and what's the right age? Is it 6 years old? Is it 10 years old? Or do we panic when acne erupts in the girl or boy child?
You know, that's a great question, Ryan, because today, teenagers are like mini adults in many ways. And I think if you look at the way the health has changed, a lot of the conditions that used to happen much later in teenage years are happening much earlier, and even in the preteen years. So I always say this, that when the transition's happening, right, from 10 to 12, that aged gap, when you start seeing the initial signs of acne, that's the best time to bring your skin in to see a skin doctor. I'm not saying this because I'm a dermatologist. I'm saying that because this is a necessity. Because you want to get the foundation right, and prevention is always better than cure. And so it's important to get the child in so that a qualified doctor can take a look and get them on the right basics. And skincare is about consistency. So if we get them into the right skincare and put them onto the right skincare products, we can actually prevent a lot of the breakouts. And if we prevent the breakouts, we prevent scarring. Because you know, the acne disappears, but the scar stays a lifetime.
I know. Tell me about it. I mean, I'm 50 years of age and we've tried so much of treatment, and the scars are something that are permanent with you, right? And I think where I'm trying to ask this question is the people that come to our nutrition clinic or the people that come to Cosmoderma, thank God they've come to you. But a lot of parents, especially the athletes who are exposed in sun and all, I keep telling the parents, go to a dermatologist in your city and get it checked out. And they're like, but the doctor will give some cream and they consider it as medication. But what they're not understanding is the amount of time they spend damaging this skin. And this point of yours, you can take care of the acne will disappear, but the scars remain. So I think this is a crucial point for all parents.
Just to bring up on that, right? It's true. A lot of them don't understand this. And I always am unable to fathom why. Because skin is the largest organ in our body. And it's also the first immune barrier in our whole defense system. People don't realize, but if you're unwell on the inside, it reflects completely on your skin and your hair and your nails. A lot of times, I've actually diagnosed that a patient could be cancerous just looking at their skin and saying that there's something off, I need you to go get tested. And we've seen that they've been in stage 1, stage 2 cancer. It's crazy, right? But that's what happens. So I always say this to people that if you had a heart attack, you're not going to go and Google remedies and do a home remedy. You're going to actually get yourself to the doctor ASAP. If your liver was troubling you, or even constipation, right? If people were constipated, they're going to go see a doctor. You may try a few fiber things, but you will go see the doctor. So why do you think it's okay for you to try home remedies or for you to not even take it seriously when your skin is reacting? People will say, oh, it's just a pimple. Oh, it's just a spot. Oh, it's just little dry. So I say that little dry or that little spot is your skin saying help and you're ignoring it. So that's what it is. And I also think that now everybody talks about dental cavities, just to draw parity or an example. So you go to a dental doctor, get a checkup done to make sure you don't have cavities, right?
You never go to a dermatologist for a general checkup.
Exactly. Why? It's a conscious thing that people must start doing because health is important and healthy skin is critical to immunity of your body.
So staying with the teenagers, Dr. Chytra, how should teenagers start caring for acne-prone skin without harming themselves? And what is it that they need to use to avoid keeping in term the long-term health of their skin?
Great question. Teenagers today, they read up so much and a lot of them are already on gadgets, right? They have Instagram accounts and some of them use VPN to crack a TikTok account, etc. And when they come to me, they have all of this data in their head and it's like da 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 da, like a back and forth with us. But I always tell them, simple. It's not that hard at all. You don't need to throw an army at tackling acne. Just go to the basics. If you have oily skin, a salicylic acid-based cleanser is what I tell these kids. Otherwise, just use a cleanser. Cleanse that skin. Keep it clean 2 times a day, morning and night. Or whenever you play sports, right after your sports and at night.
Can I interject here? When I was young, I thought washing my face with a lot of soap multiple times in the day would prevent me from getting pimples. So do my athletes think the same thing.
It's the worst thing one can do to themselves.
Can you expand on this point?
The skin is acidic by nature. We have something called the acid mantle, which is...
Acid mantle.
Acid mantle.
So it's like the earth's crust. There's a mantle on the skin.
Exactly.
Oh.
Just under what you see as the skin, just under the surface, there's an acid mantle. It's a barrier. Okay, it's called a hydrolipid barrier. It's made from the water component from the sweat and the oil component from our oil glands. And oil and water don't mix. So there's a seal on our skin. And this maintains the acidity of our skin. It maintains the natural moisturizing factor, or it prevents water loss. It prevents chemicals from getting into the skin. It prevents from things getting absorbed, unnecessary stuff, etc. So when you put soap is an alkali, so it goes back to our chemistry. You take a basic or an alkali, put it to acid, you're neutralizing. If you neutralize your skin, you're going to let everything attack your skin.
So using soap actually enhances or aggravates your acne.
Exactly, because you're breaking your skin barrier down. The most important thing for a skin is the skin barrier. And the skin barrier is about the oil, it's about the water, and it's about the acidity.
So if you're a teenager in college, it's better to just wash your face in the college with plain water
Exactly.
and just dab it dry.
That's fine. I'm okay if you just wash it with water and just not rub it, but dab it dry gently.
Why not rub it?
Because when you rub it, it's friction,
Yeah.
and friction causes micro tears in your skin. And again, that will let the bacteria, virus, fungus,
I wish I
etc.
met
through.
you when I was a teenager, because I would wipe my face like that. Thing,
That's
the
what
pimples
people
would
do
go away.
even now. And you'll be amazed. So many parents will tell me, I'm telling my kid, just wash your face with soap and rub it. They don't listen. If they rub it, the oil will go. I'm like, where is it going to go?
So a lot of old wife tales over there.
Yeah. And so I always tell them, look, you have to make an informed decision. And teenage acne, believe it or not, 70% of teenagers today suffer from acne. And there's a study from the Journal of Pediatrics, right, which talks about the mental effect or emotional impact that acne has. More than 60% of teenagers say they don't go to social events because of the acne on their face.
So this is actual study.
Actual study, actual data. 60% of teenagers with acne say it impacts them so much that they actually cut back on their social. I had a patient, she's my co-founder at my skincare company. The way I met her was this. She brought her daughter in to see me, 11-year-old child, beautiful. And she came and told me, my daughter was never an outgoing kid, but she would participate and she was full of smile and happiness and joy. In the last year, I've seen her personality change, and she doesn't smile. She doesn't come out of her room.
Why?
Because she got pimples. They didn't realize why. But when they sat down and had a chat with her, her acne bothered her. And her parents said, it's only 5-6 bumps on her skin. It's normal for you. You're 11 becoming 12. But those 5-6 impacted her so much. So they brought her to me and they were like, we don't want to do anything aggressive. We want to keep it natural, etc. And I was like, look, natural is great, but we'll have to do science-backed skincare here. And so I just put her on skincare and a monthly cleanup, which is a medical cleanup in the clinic. And 3 months in, she was a lot better. 6 months in, we'd clean it all up with just this much. And now I see her every quarter for her maintenance. And, she's back to this outgoing girl and she's playing instruments. She's got this whole friend circle. She's super social, etc. But that's the impact that can have on the kids. So I always tell parents, do be sensitive, because they'll come and say, look, I had acne. I grew out of it. They'll grow out of it. But the generation has changed. The environment has changed. The society has changed.
I think we should talk to the mothers now, because
And fathers.
And fathers. No, I think I question the fathers a lot. The fathers are like, if the mother's okay with this, then we'll go and see the doctor.
It's changing. I would say there are kids who come in with just their parents. And I actually have kids who come in on their own now, 14-year-old kids who come in on their own. And I'm like, look, we need parental consent to do anything. They're like, yeah, we'll call our mom and dad. But, I'm here because I really want to take care of my skin.
Wow, that's amazing.
Yeah.
So let's shift to the mothers, the Indian women, say they're in the age group of 35 to 50. Now, what's the biggest myth that Indian women believe about aging? Because one they have is like, you just wash your face, and we had it.
Don't get me started. So many myths, right? I think one of the myths is that they think that because their grandmothers had great skin or their mothers didn't do it, they don't need to do it. They're like, my mom has good skin today. She never used a sunscreen. My grandmother didn't have to do all of this. They have great skin. So why do I need to do it? That's one myth. The second one is using coconut oil, almond oil, ghee, stuff from your kitchen on your face, and that's more than enough, and I'm going to have great skin and I'm not going to get wrinkles. These myths bother me. And the third is natural. Why can't I use natural things? I'm like, everything in the world is a chemical. Water is chemical. It's H2O, 2 parts of hydrogen to an oxygen. That's also a chemical, right? Remember your tables from, chemistry class? So I tell everybody natural is great, but after a certain point, your skin requires additional help. And that's when you can have natural based ingredients, but it has to be science backed. Throwing the kitchen at your face is not going to work. But stuff like that, right? So these are the 3 myths that bother me. Just coming down, you won't believe it, Ryan. The number of people who tell me, I use oil on my skin, I don't need a moisturizer. My mom did this, my grandmom did this, so I'm doing the same.
Dr. Chytra, can you tell us what is the science-backed efficacy on why this using oil in your skin may be harmful?
Got it. It's really about having evidence that things work. Not just a hearsay, not an old fishwife tale, not just a hand-me-down, but really science, data, research, studies that prove the good stuff and prove the bad stuff also. When I say science-backed care, it doesn't necessarily have to mean just pharmaceuticals or drugs. There's a lot of science-backed skincare which are over-the-counter too, which have studies which are done on skin that's typical to you, like Indian skin, right? Let's say we're all Indians, we have Indian skin type, it's very differentiated from other skin. So look for a product that actually has done studies on Indian skin independently with registered trials, which are like drug trials, and says this many people used it, and when they used it, this much change happened in the skin based on this measurement. Not 90% felt good, 80% loved the texture and feel of their skin. That's just a texture feel. That's not a science-based study. A science-based study will give you exact measurements that 93% improved on their skin texture by, let's say, 25% in 4 weeks after use of this product. Stuff like that, right? That's science-backed, science-based, where the ingredients are of pharmacal level, they're level 1 ingredients, they have quality behind them. Now, using oil. If you have very dry skin, eczema, and broken skin, yes, you can use oil. Coconut oil is good, olive oil is good, almond oil is good. But otherwise, oil on a daily basis will actually clog your skin. And using oil doesn't mean that it's going to get completely absorbed in. Just using oil is not enough because your skin, like I said, it has oil, but you need the water component too. Until the age of 25, your skin is actually quite forgiving because you have the growth hormone, you're in a growth stage. But aging in skin starts at 25. When people say, when do I start aging? I'm like, at 25. But actually, the day you're born, really. But the downward slope starts at 25. And so if you don't have a good habit, which is consistent from your teenage years, you're going to suffer from long-term damage.
So there are these myths. And obviously, you must be having some small ingredient or ideas for women in their 40s. What would you say to them?
Sure. One, invest into a great sunscreen. I always tell my patients, even if you don't use anything else, invest into one good sunscreen. That's most critical, like a SPF 40 minimum because nobody uses the rest amount that's required, maybe with a built-in vitamin C. So vitamin C is the ingredient that I talk about a lot. L-ascorbic acid, antioxidant, protects us from damage, it's reparative, etc. So make sure you have that, L-ascorbic acid, vitamin C. And if you're in your 40s, you need to introduce some amount of peptides or retinol into your skincare 2 to 3 times a week, not necessarily on a daily basis. And the other thing is your skin barrier is important, so look at investing into ceramides and hyaluronic acid.
Dr. Chytra, I do a lot of nutrition counseling for women.
Yes.
One of the questions they ask me is cellulite.
Yes.
Can you get rid of it? Now, as a nutritionist, I know that food molecules cannot help cellulite very effectively. But from a dermatology and aesthetic point of view, there are a lot of things that women can do. What is your advice?
Cellulite is just basically pockets of fat that's projecting through your skin because the tone of your skin has gone down. So as we age, the collagen goes down in our body and the tone of the skin to hold things back goes down. So the fat pockets are projecting. Using a gel, cream, lotion is not going to work. It's a waste of time. So please don't waste money on it. What you can do is lymphatic drainage, radio frequency, electromagnetic pulse therapy. These are the three combined together that you can do. There's a equipment called LPG or endomology. A lot of the stars like J-Lo, Kim Kardashian, Beyonce are known to use this, actually have them in their homes to use this to keep that smoothness in their body. So that's what you need to do, because you need to get your skin to get tighter. You need to break up those pockets and smoothen it out. You need the lymphatic drainage to improve in this. It's not about being skinny, not about being fat, not about being muscle tone. It's really about the skin tone, but it can be treated.
But in all of this, would you say that, did you ever experience that women who worked out have a better skin tone than women who don't work out?
No, not necessarily. But women who work out have better muscle tone, so the stretch of the skin is better, not the skin tone. Skin tone is not affected by just workout. It's affected by nutrition, and it's affected by other stuff that you do. It has to be about your collagen and elastin.
I'm going slightly off topic over here because you just put a thought in my head. A lot of cold plunging has started.
Yes.
And it's 6 degrees to 7 degrees Celsius, and some people are getting a cold plunge which is even lower than that. Does this do harm or does this do benefit to the skin? Could you give us Dr. Chaitra's advice? If she started cold plunging, would she do it or she would not do it? And if she did it, what would be her protocol?
Look, with cold plunges, I think everything in moderation, honestly. And it's not necessarily suitable for everybody. If somebody had Raynaud's, like I have a condition called Raynaud's, where the end of my nails and toes don't get enough circulation. So if it's cold, I could get a frostbite. So if I'm going cold plunging often, I'm going to frostbite myself. But cold plunges are good because they will shock your body and boost your metabolism. For that part, it's great. But that doesn't mean you're going to do it every day, because then your body is going to get used to it. So like I said, everything in moderation. Once a week is good enough, but more so for recovery. That's where cold plunge has a play.
Okay. So people putting their face in a cold bowl to tighten up the pores and all.
Great. It does. It tightens it up for all of 60 to 90 minutes.
So
it's
just
quick fix.
Just before the party.
Exactly. It's just a quick fix, right? Because think about it. Cold, what happens? Contraction happens. So everything gets a little tighter. But that only lasts 6 to 90 minutes. The rest of it always comes back. So you want to do something that's more long lasting.
When all of these clients come to me for a nutrition plan, they do say, Ryan, I get breakouts. And then I see a lot of the women, right from teenagers to even my mother till today, they will be using makeup. They will be going to the salon. They will be putting nail polish. They will be putting color in the hair or dyeing the hair or whatever it is. And as a man, I'm like, I just look at logic, right? There must be stuff that takes care of your skin from a science chemical point of view. And there must be stuff from a chemical science point of view that's harming your body. So do you feel that because of these skincare products or the layers of makeup that people might be wearing daily, they're breaking out more or have more skin problems?
I think it's a combination. Honestly, it's not just one or the other. It's a combination of multiple factors. Makeup is okay, but the thing is, makeup has changed now. Before it used to be 1 or 2 layers. Today, there's almost 6 to 8 layers to a good makeup, because you start with like a primer, and then you start with a color corrector, then you start with your foundation, and then you have your highlights, and then your lowlights, and then comes the rest of the stuff. So that much layering is that much clogging. It's okay if you double cleanse. The problem is people don't cleanse it out before they go to bed.
What's a double cleanse?
Double cleanse is where you do a cleansing routine 2 times. So you'll use a water-based cleanser and an oil-based cleanser. So like a lot of times the makeup is waterproof. So you'll use like an oil-based cleanser to take off the waterproof makeup. And then you'll rinse it all off with like a water-based cleanser, like a foaming cleanser or foaming wash, etc. Or a makeup wipe. People don't do this. They'll just use a makeup wipe, throw water, head to bed. But if you don't cleanse the makeup out, when you're sleeping at night, your skin breathes at night. So when the pores open, these makeup particles are sitting there. It gets imbibed into the skin. That causes clogging on a deeper level, leads to breakout. The other thing is stress. We don't talk enough about stress. Stress is a big indicator today. And everybody has some form of stress in their life. And that directly impacts the skin. And a lot of times, the adult acne that we see, the breakouts, is one from the lifestyle factors, and second, from the stress, which impacts your hormones.
So, Dr. Chaitra, you and I both live in this wonderful city of Bangalore where the startup culture is through the roof. And lot of people are getting into these Korean skincare brands. And I'm like, is this really that the Korean skin and the Indian skin is the same thing? Should Indians really follow some logic of a Korean brand and this that they have a great product? And or should we look at customizing science to the Indian skin?
I am so happy you asked this question. It's my pet peeve. I always say this when patients ask me that, and even when I see them, I always tell them just bring all the products you're using so I can read your labels. 8-step, 10-step, 12-step skincare. I'm like, wow. Look, Korean skincare is good. There's no doubt about it. A lot of them are good. Some of them are trash, just beautiful packaging. But it's for Korean skin type, which is lighter skin tone, which is exposed to cold climates, which has a different oil factor, and pores are their largest problem. Indian skin is pigmented. The crux of our problem is the melanin or the pigment in our skin. We tend to live in a temperature that varies. Like down south, it's more humid and hotter. Up north, it can be colder, but it's never icy cold. It's only maybe 3 to 4 months the year. So it's very different. Both skins act completely different. If I took a Korean person, I sat here and I just scratched their skin, it'll go like a little red mark and they'll heal in a week. I do the same to an Indian patient. It'll take a while to heal. It'll leave a brown mark. That'll take up to 6 months to heal. Yeah. So there are so many nuances. So when a patient says, can I use Korean skincare? I'm like, if you're Korean, please use it. That's my answer, honestly. But there are some stuff that you can use, some products that you can use, key products from there. It doesn't mean that you have to follow their regimen because all their products were tested on Korean skin and Korean climates. It wasn't tested on Indian skin. And there are certain ingredients that are great. So you can pick up some actives from there, combine it with your basic skincare routine. And for Indians, I always say this, your skincare routine is really simple for Indians because you genetically are blessed with decent skin. Forget acne and everything. But all you need is actually a 3-step routine. You'll be amazed, but it's just 3 steps that you need on a daily routine. First, a gentle cleanser, which is pH balanced, soap-free. Second, a moisturizer or a skin barrier cream, which has some amount of ceramides and moisturizing elements to it. Third, sunscreen. That's all. Even in this, if my patient says, I'm not going to do anything, just tell me one thing. I'm like, just cleanse your face with water and please use sunscreen. That's all. This is your basic. If you do this day in, day out consistently, you'll go well into your 70s, avoiding 80% of skin trauma. The rest of it is all layering, it's marketing, it's sales, it's gimmickry.
And the Nutrition clinics, Dr. Chaitra, I get everybody, both the men and the women, asking me, I've got dark circles under my eyes. I've got pigmentation, especially those who are 45 to 60, women coming towards the menopause. Suddenly they start getting these dark patches. I think you call them
Melasma.
Melasma, right? Stretch marks after children, or I do weight loss, so people shrink in size and then they can see the stretch marks and all. Now, the first question is it genetic or is it lifestyle driven? And can skincare with a dermatologist begin to address these problems?
You know, genetics is like a gun that's loaded. It's lifestyle is the trigger that pulls. So it's a combination. You're dealt a card, right? But how you play the hand depends. Dark circles is a great question because genetically, Indians are prone to dark circles because of the way our bones are formed in our face. It actually comes down to the skull structure. This cheekbone right here tends to be more flatter in Indians compared to others, compared to like a Caucasian or an African race or a Middle Eastern race, because of which we get this sunken hollows. And when that happens, the skin around our eyes is the thinnest in our body. everywhere in our body. If you compare, the thinnest is just under eye skin. So what happens? One, you're sunken, so it's already got a shadow effect. The skin is thin, so as we age, it gets thinner. When it gets thinner, it starts reflecting what's underneath, which is your muscle. And muscle is more purplish in color. So that reflection creates another shadow. Third, this is where you come in. Vitamin B deficiency, iron deficiency, vitamin D deficiency. We know that, with our diet, most Indians have some form of vitamin B and D deficiency. At least 80% of the time when I test my patients, they have this. And iron. So when I optimize this, a lot of times it becomes okay. Next, skincare matters because you want to keep that area thicker. So using a skin barrier cream, using sunscreen and some peptides. If one can manage this, that'll really help. Then of course your lifestyle triggers, partying late because you didn't get enough sleep will accentuate it. Excess alcohol, excess drugs, which is common today, sadly, all of that adds on to it. And also, you asked me about why in menopause, right? The pigment patches. Because of the hormone changes. Perimenopause starts 10 years before menopause. Yeah. So menopausal age is anywhere from 45 onwards. So perimenopause is actually 35 to 37 onwards. And what happens here? Women produce estrogen, progesterone, testosterone, all the three. During menopause and perimenopause, the estrogen starts going down, progesterone starts going down, but the testosterone doesn't go down as much. So that gets a little bit more of an upper hand, which means you start seeing more oiliness in the skin, the acne breakouts, you start seeing thinning of the hair. And because of all of these changes, your skin becomes weaker, so more damage, you start getting hyperpigmentation, which is called melasma. And these are the reasons this happens. But if somebody was using a sunscreen from a young age, they can actually go through menopause without having hyperpigmentation. Like right now, I'm menopausal. I'm 48 and I am menopausal right now. But I don't have any pigment patches because I've used sunscreen since my teenage years, thanks to my mom, who was an advocate that you cannot step out without sunscreen. So that's what it is. Just using the right skincare, being consistent can take you through all of this without having all of these concerns. This happens because you didn't take care of your skin. If you'd taken care, you would not have had these problems.
Speaking of taking care of skin, new mothers, they come to me. I remember I did Anushka Sharma's post-pregnancy weight loss, and she came back in about 4 months to a movie, and the world was shocked about how quickly she lost weight. And so everyone comes in and they say, I've got skin pigmentation, I've got acne, I've got hair fall problem, and so can you quickly fix it? So what is the skincare regime for pregnant mothers? I think pregnant mothers have really good skin.
They do, because of that glow from the progesterone. It's fantastic.
So how do we sustain that post-pregnancy? Because most mothers give up. Like, I've just given birth and I have to take care of the kid. I can't sleep. I don't have time to take care of myself. So what's your advice as a doctor?
I asked them, did you stop brushing your teeth? No. Did you stop having a bath?
Oh, but Dr. Chaitra, I have no time. The baby, my husband, my mother-in-law, and I hear all of this, and I'm like...
Even I hear all of that. So that's why I asked them, just keep your skincare next to your toothbrush. When you brush your teeth, immediately wash your face, put that moisturizer and sunscreen. That's all you need. 3 things, right? Cleanse, moisturize, sunscreen. Forget the rest. Just do this much. That's all you need to do. Because if you maintain your skin barrier, nothing's going to damage that.
I remember when Devika, my wife, was carrying icon and then she delivered, she would make it a regime to come across to your clinic and get a hydra facial done, just get pampered.
Yes.
What do you advise the mothers? Should they have the me time and just take 2 hours away from the baby, because the baby is going to be okay without you? And I think dads nowadays are also equally competent to take care of the kids for 2 hours at least. So what do you advise for women? What should they come to your clinic and do?
I always tell women that even during pregnancy, pamper yourself, get your prenatal massages, etc. Because it's not just about taking care of your skin, but it also that whole calming feeling, right? It plays with your mind, it de-stresses you, and it puts you in a zen zone. The calmer you are, the better it is for you and your baby too. Post delivery, sure, the first 4 to 6 weeks is a learning curve for any first time mom, but after that you can start taking 2 hours out. Even like if you take that 90 minutes, you feed the baby, give it to someone to burp it, go out, get a 90-minute facial, come back in. That's more than enough. I think it's not about not taking time. It's about the bandwidth in their brain. And it's also the societal pressure, the peer pressure, etc. Right? Because, I had clinics inside motherhood hospitals in 2012 to 2014 to help mothers take care of their skin and hair needs, and also for stretch marks. Even when the mom came, it would either be somebody in their family telling them, why are you doing this? You are going to have a baby. Your attention should be focused on having that baby. It doesn't matter what happens to you. Later, take care of yourself.
But that's so wrong, right?
It is wrong. And then the woman should have the strength to say, hey, I matter. Yes, I've had the baby, but I matter too. And that's where the woman needs to strengthen herself and stand up for herself, make time for herself. But, we've all done this, given into pressures. So that's why I tell my patients that, look, you need to take time. If you can come in once a month, at least do it once in 6 weeks. Take that time once in 6 weeks. If you can't take time for a facial, at least put a face mask on at home and, just take that time for yourself, because just doing that, calming your entire system, puts your whole body into a zen zone again, which actually de-stresses your hormones. Otherwise, that stress is very bad.
In fact, I tell all the men out there that don't expect your wife to go and get the skin treatment herself, because she's too busy carrying the baby and thinking about other things. Yeah. And she expects you to gift her that. Because when it comes in from your level as a gift, and I remember I did this for Devika.
I remember, and I thought it was the cutest thing ever.
And she was like, okay, I'm off for my me time and stuff like that. And I think that's important, because a woman carries a baby for 9 months. She goes through a lot of hormonal fluctuation. Yes. She goes through a lot of, I wouldn't say fear, but the unknown, especially first-time mothers,
fear.
Right?
Yeah.
Will I have my body back again? Will I be able to carry this child to term? What if it's a C-section? What's a normal delivery? How will I cope with it? And these are all standard questions, but a lot of women forget that they are still women.
Yes.
They suddenly outsource their bodies, like, now I'm becoming this mother, so I've forgotten who I was. And I think it's very important for the men. So that's what I'm trying to communicate here, is that it's a responsibility for the guys. Look, guys, our job is done once the bun is in the oven. After that, your wife asks you for pan or, golgappas from another city. You get on a flight and you go and get it for her. But other than that, what else do you have to do besides press her legs and get up in the morning and just rub her back? And we don't have to do much, but she has to do a lot, including her own skincare.
It's true. You're so right about that. Just last week, I had this patient. Her husband actually brought her in. They have a child 3 months old. And he said that, I know my wife to be this cheerful, bubbly girl. And after she's had her baby, she's been so busy. This is the second child that they've had. The other one is 3 years old. And so she's like, between the two, we do have help at home. Like, his mom is there. But she's not herself. So I brought her here. Doc, can you do something? So all we did was, again, a hydrofacial, because it's just hydration, right? And that pampering and stuff. 19 minutes later, she was out. And then he came back just yesterday, actually. And he said, Doc, thank you. I want her to do this every month. I've not seen her happier. And it's true. It does reflect, right? And you and I always say this, right? Happy on the inside, glowing on the outside.
So speaking of glowing on the outside, when I married my wife, her side of the cosmetic cupboard, I wouldn't say a toothbrush cupboard, had all of these creams, and I would keep looking at her side. And my side had shaving razor, shaving cream, and it was the toothbrush. I would even borrow her toothpaste. So now, 15 years into our marriage, I have more skincare products than her. Okay, so it is a $1 billion industry. We men are getting vanity. We want to take care of our skin.
Yes.
But sometimes I'm like, girl skin, boy skin. So I quickly rob my wife's cream
Yeah.
and I put it. She says, don't touch that. That's for women's skin. I'm like, skin is the same. It has no gender. So please correct as men. Does our routine need to be different? And is the skincare products different for men?
Not really. It's just marketing, actually. The skin is different. Like, men have a little bit more thicker skin, and they also, because of the testosterone, tends to have a little bit more oiliness. So the only change would be probably in the cleansing routine. Like, you may want to use a salicylic cleanser 2 to 3 times a week, just to take the oil control. But the rest of it is the same. It just comes back to that sunscreen. It would be the same sunscreen, a guy or a girl. It's the same kind of moisturizer for a guy or a girl, except if you're oily skin, you'd use a less oily moisturizer. Otherwise, it's actually the same, Ryan. You could build a brand saying men, you could build a brand saying teenage skincare, but skin is skin. It's actually very undemanding. All it says is, give me 3 things every day. That's all. But every day.
So Devika, you heard it. I can use your creams from today onwards.
Hey, keep it to yourself. You have your own.
So when it comes to sunscreens, there's mineral, there's chemical, there's tinted or organic. Which really works best, especially for our Indian skin tones, given the kind of sun exposure we have in our country?
Look, there are various sunscreens, right? Physical, chemical. Then there's hybrid, which combines these two. Then there's mineral sunscreen. Then the tinted is where you've added a bit of tint to either of these categories. Any sunscreen is better than no sunscreen. That's my first point. Second, choose one that suits you. Now, if you have a darker skin tone, you may not necessarily do well with a physical sunscreen because that has zinc oxide. Even if it has micronized zinc oxide, it leaves that whitish tint. So you have that ghost-like appearance. So a chemical sunscreen would actually work better on the darker skin tones. Mineral sunscreens are also very efficacious. They actually work really well, tend to be a little bit more expensive than a chemical sunscreen. And nowadays we have hybrid sunscreen, which combines chemical with physical, so that you get a little bit more of a skin barrier impact on that. So if somebody's more outgoing and sporty, I would advise this. What would I say to look for in a sunscreen? Look that this SPF is proven. Everybody claims SPF 100, 70, 50, 40, 30. The minimum SPF I say is a 40. 30 is good, but why 40? Because when we test sunscreen in a lab, it's tested as a 5-gram product. 5 gram is 1 teaspoon. Nobody uses 1 teaspoon of sunscreen on their face. So you're going to use like half of that. So you're already halving the efficacy of it. So you want to use a SPF 40 to a 50 so that, you have that efficacy lasting for you. So make sure SPF is tested. Then look for something that says PA. PA is like PA, it comes as a plus sign. So you want minimum of a 3 plus to a maximum of 4 pluses is what you get in the market. SPF is protection against UVB. PA is protection against UVA. That's ultraviolet B, ultraviolet A. So it has to say broad spectrum. Look that the sunscreen company has printed lab testing to prove the efficacy, because India, sadly, you can claim anything on the labels and get away with it. Nobody tests them or checks them even till today. So check for that. That's it. That's all you need to do. And then try the texture if it sets when. And a lot of people try it on their hand. I always say try it around here because the skin on your hand is different from the skin on your face and neck. And when you use a sunscreen, face, neck, and the ears also. Apply this entire area. Next, if you can use the newer sunscreens which have actives infused on them, even better. Today you get sunscreens infused with vitamin C. That is by far the best combination. Why? Because when you have a sunscreen, no sunscreen is 100%. It's between 96 to a 98%. But so you still get damage. So if there's vitamin C built into your sunscreen, the repair already starts for the sun damage. The antioxidant is there. And if you have very dry skin, you can use one which has a hyaluronic acid built in. So look for something like this.
If you're driving in a car,
yes,
there's windows all around you.
Yes.
Does the sun still affect you?
Yeah, because the UV radiation penetrates glass. So you're still going to need sunscreen. I always say that the only time you don't need sunscreen is if you're a vampire who lives in a dungeon. It's true. Otherwise, you need sunscreen at all times.
So even if you're in an office building and there's a glass thing,
if there's light coming through the windows, you need sunscreen. It's as simple as that. And Now we talk about blue light, right?
Mm.
From the screens, like TV screens, computer screens, large computer screens and stuff. Blue light therapy, that's also important, but it's not absolutely critical because the amount we have from our device matters. Like if you're using it for an hour or two and you already have sunscreen on your skin or and vitamin C antioxidant, you're protected. But blue light filters become critical for Bangalore people, like techies, right? You're in front of your system 8 to 12 hours a day. And if you already have damaged skin or there's a family history of melasma, you should look for sunscreen with a blue light filter.
Sunscreen with a blue light filter.
Yeah.
Wow. That's something I've learned today. Okay. So, Dr. Chytra, I had a lot of scars and we started on micro needling to work on the scars. So, when it comes to treating scars and signs of aging, how does it work and does it really work?
So what microneedling does is it causes micro injury to the skin. And when the skin is injured, it says, oh gosh, I'm injured, so let me repair it. And repair means it lays down new collagen in there. And if we're able to stimulate to a deeper level with certain devices, we can even get some elastin stimulation. But it really is about building collagen. Let's take up this. If your skin is even, like this, right? And you get a dent or a scar, it's like this, a pothole in a road. A pothole in a road, you'll fill it from the top. Here, we need to push it up and spread it out.
Oh.
And that is laying collagen. So when we do a microneedling, it goes through the surface, causes injury, starts cell repair here, pushes it up slowly, and then you get the surface to get smoother. That is what happens. And the results really depend on the depth of the scarring and the type of scarring, right? So microneedling is great for scars, but it's also great for just skin maintenance long term. Did you know that after 25, we lose 1% of our collagen every year of our life? When that happens, think you've lost 25% of your collagen by age of 50. But there is a wrench here. At age of 40, there is accelerated aging. So it literally doubles up.
Ah.
And then your next accelerated aging is at the age of 60. Again, another double up. So by the age of 60, you literally lost 50 to 60% of the collagen in your skin. And collagen is important not just for the smoothness of your skin or the tightness of the skin, but it's also about the quality of your skin, because water molecules get stored between these collagen bundles. So if your collagen deflates, the quality of the water in your skin decreases. So you start getting drier as you age, and that acid mantle that I speak about gets broken. And so microneedling helps with all of this. So one can do microneedling not just for scars, but they can do it on a quarterly basis from their 30s onwards, just to maintain the tone of the skin. And everybody talks about open pores, open pores, open pores. Open pores are natural because your pores open onto the skin, but they look more open as we age because the collagen which was keeping it closed is lax, so it opens up. So you keep doing the microneedling, that pore still stays closed, and we can deliver a lot of these new regenerative products like exosomes, polynucleotides, even PRP, growth factors, etc., using microneedling.
Staying with growth factors, for me as a nutritionist, we constantly want to give people better nutrition. So we change the diet, we do supplements and all. Now, injectable wellness is becoming a new trend. IV drips for beauty, for energy, for sports performance. Even I've heard about fat loss with L-carnitine and all.
Yes.
So, are they transformative, or is this hype happening right now?
It's still in very early stages. A lot more evidence data needs to come out of it. So yes, there is long-lasting data, but not enough random control trials for us to say, yes, this definitively works at this dosage for this person. Everybody is an individual. So the protocols actually have to be individualized to the person. Like your diet plans, right? You look at the diet, like my patients who come to you, your consultation process is so elaborate because you individualize the diet. Same way, we need to individualize the protocol for skin care, skin treatment, plus the IV nutraceuticals and treatment, because what I give you is not going to work for Devika. If I gave you IV drips, what I take will not necessarily work for my husband. Same way. And so that's why it's important that you see a physician or a doctor who is trained to do this. It's not something you just walk in, get a plug in, and then walk out. You're not an electric car that you go in and plug a charger, get charged, and come out.
And that's where I have this problem today, is that I've seen a lot of beauty places
Yes.
which don't have a doctor present are doing the IV infusions. And I'm like, I don't think that's right. But I think everyone's trying to make a fast buck.
Yes.
And they're trying to give, it's like telling everyone, please take a multivitamin
Exactly.
without consulting the nutritionist or the doctor.
And every influencer is giving nutrition advice. Every influencer is giving skincare advice. And you're like, guys, there is science behind this. You know, you can't just say, hey, eat this, eat that. You can't say, apply this, apply that, or take these supplements, because supplements impact your inside, and that impacts your gut, and gut impacts your skin.
Speaking of supplements, Dr. Chaitra, have you ever had any story where somebody has abused supplements and it's damaged the skin?
Oh, yeah. So, you know, vitamin D, let's just talk about it, right? Everybody's like, vitamin D supplements, etc., and vitamin B supplements. Even if you have vitamin B excess, it's not harmful, but vitamin D toxicity is a problem because it impacts your kidney, it impacts your liver. And does it really impact the skin directly? Not so much, but it does impact your liver and kidney. I had a patient who had kidney stones. Like, okay, so this patient I saw, she's in her late 40s, and she's a know-it-all. She knows everything about everything, right? She reads a lot and she does everything, all of that. And she kept seeing all these things talking about supplements, calcium supplements, magnesium supplements, melatonin, vitamin D. So she self-started and she kept on
she
it.
Self-prescribed herself.
Self-prescribed, because you can get it everywhere, right? So she self-prescribed. She did it for a long time thing. And I've been seeing her for her skin. And as part of our skin routine, we insist on a blood workup every year. I told her, your vitamin D levels are off. She said, and I said, I have not put you on any supplements. So what are you doing? And then she said, oh, I'm actually taking this. And one of the things I saw from that was her healing period was actually taking longer in our procedures. Because, you know, when you do a procedure, you get redness and you heal fast if your skin is healthy. She was taking longer. So the vitamin D toxicity was actually delaying the healing in her skin. And she started getting these pain in her abdomen. And then she called me saying, Doc, I'm having abdominal pain. Why do you think? Is it because of the procedure? I said, I did it on your face. That's nothing, but go get an ultrasound scan because your vitamin D is high. Maybe there's stones. Behold, she had stones.
So self-prescription is never good. And I think this world of influencing, even via a podcast, I always tell people the aim of influencers and podcasts is to bring about awareness.
Yes.
But the idea is to go and consult.
Yes.
And that is why you are a doctor. I am a nutritionist. I cannot prescribe a drug. You can prescribe a drug. I can prescribe a nutritional supplement. But what people do, and especially we see this in India, even with paracetamol use and painkillers,
Yes.
muscle relaxants, sleeping tablets are just randomly be prescribed by the pharmacist,
Yes.
the pharmacy guy, and we have people destroying their health.
It's true.
But let's come back to skin.
All right.
Okay, because that's where you are the celebrity doctor. You work with a lot of people who want and demand the celebrity skin. What is the average thing that a person can do for, say, becoming Aishwarya Rai or Shah Rukh Khan?
You know, the difference between you and me is you can name all your celebrity patients and everything. I have NDAs with all my patients. I can never take up names. Same thing I advise my other non-celebrity patients. A good skincare routine, consistency, and something to stimulate the skin every 4 weeks. The reason is our skin cycle is a 4-week cycle. And so every 4 weeks, you need to intervene after the age of 25 so that the skin cycle stays activated. Otherwise, it starts going sluggish. The moment it goes sluggish, you start seeing all the skin concerns on that. So this is what I advise them. Plus, I advise them to take care of their lifestyle habits. I know it's hard because they have these shoots at all odd hours and everything. But I'll tell you the story. A few weeks ago, I had this patient. She's on an off-site shoot. But she's got it into her contract because she knows her schedule with me. And she has those days off marked into her shooting calendar. So wherever she is, she gets paid to fly in to see me, get her skincare done, and goes back. That's how religious she is. And she's flawless. Like, if you look at her, you think she's just naturally beautiful. And she is. She's naturally beautiful. All I'm doing is
But you still
maintaining it.
you still
We
require the
maintain her.
maintain it. It's like a Virat Kohli knowing how to play cricket, but the amount of effort and work that he puts not only into his physical fitness training, his sleep and his diet.
Exactly.
He could easily say that, I'm at the top of my game, I don't need to do this. But their maintenance is at the next level.
It is the discipline, that consistency. And I'm very harsh with my patients. I'm like, if you're not going to follow my advice, please don't waste my time. I am, because I would rather spend that time at home with my 8-year-old son, or I would see another patient who's more deserving, who needs my help, right? So I always say this, and so I make sure that discipline is already there. So I always tell patients this: the only difference between my celebrity patient and you is the discipline that they put in. Because for them, their face is their fortune, right? And we're very unforgiving. A little mark, a little dent, oh my God, why did they do this? But then they look good and they admit that they did something. For that also, we're going to say, oh, look, she's doing this, he's doing that. We're a very unforgiving and judgmental society.
So, Dr. Chaitra, I wrote a book called Wheatless about gluten intolerance, and it's got many chapters wherein we talk about patients' alopecia, where your immune system attacks your hair follicles, acne, eczema, psoriasis. Now, we do a lot of testing, both the food intolerance testing or the genetic testing, which shows how the person has that HLA-DQ gene and could be sensitive to gluten. Now, do you see as a doctor that gluten and dairy are huge food culprits? And when is the best time to test, if you do ask your clients to test? And how do you convince people to give up bread and milk?
I love your book. I gotta say that though. I read that. You sent me one, and I'd actually already ordered one too. And then a lot of my patients, I tell them to read your books just so that they get an idea how important gut health is. Coming down to the question, diet plays an important role in skin. There is established data now that there is the gut-skin axis. So garbage in, garbage out.
Oh, that's a beautiful line. Garbage in, garbage out. I'm going to start using that in my counseling.
Please do. I always tell my patients, I will do the best to fix all of this. But if you don't start eating healthy, then there's only so much I can do to you. You've really got to improve on your lifestyle habits. That's why, my team coordinates with your team to send a lot of patients across and all this stuff, because I truly believe that inside and outside are like this. It's two hands shaking, literally. Now, coming down to low-grade inflammation. The diseases you spoke about, they all have a autoimmune component, right? Like alopecia, which you're talking about, the little circular hair losses. It has an autoimmune component. Hashimoto's thyroiditis has the same thing. Long-standing psoriasis, eczema, even to a certain extent, other conditions. So, even acne, something that most people will experience in their life. When I treat them, I also ask them about any supplements they're on. What is their current nutrition program, if they have one, or what's their diet like? And if it's a long-standing acne, I do ask them to see if they can get a food intolerance test done, or even ask them to do a genetic testing if they can afford it, to see what is happening. Because, when you have all these tools to improve your health and you can afford to use it, why not use it? That's all. That's what I say. You'll be surprised. Long-standing acne, adults, 30s and 40s, when they have acne, just by changing their diet and eliminating certain food, right, the acne improves. The main culprit there for us is dairy, and then gluten to a certain extent, but dairy and sugar, this is the biggest culprit for us. So I tell them that you really have a sweet tooth, shift to dark chocolate. I'm okay. I'll still let you one cheat day a week, but the rest of the time I want sugar out. And patients will say, I never have sugar except with my tea or coffee. I'm like, how many cups? Maybe 4 cups a day. I'm like, right, that's it. And then they're like, I have a lot of fluids. Like what? I drink juice. Which juice? The packaged juice. I'm like, that's loaded with sugar. I'm like, you want to drink juice? Please drink fresh fruit juice. But I don't want you to have any packaged drinks because everything like that, right? So sugar and diet is for me is the biggest culprit because I deal with mainly aesthetic concerns of the skin. I don't do clinical dermatology anymore. I only do aesthetic dermatology. But hair fall, if somebody's having hair fall which is unexplained for a long period of time, gluten becomes a culprit for us. I tell them, start looking and seeing if you can eat less gluten. It takes about 8 weeks to 12 weeks to see the change. So they need to do it for that long, but it definitely impacts.
Dr. Chaitra, what is your skincare routine? Do you have an AM and PM skincare routine?
My skincare, I've been consistent with this for years. It's really simple. I use a cleanser, which is pH balanced. And I have a skincare brand. I have two skincare brands. One for Cosmoderma. So it's the Cosmoderma. The other one is SkinQ, which is available online. So I actually use a combination of these two products. And one of the reasons I actually made this product was because I couldn't find what I needed for my skin. So that's why I started making skincare in the first place. So I use a pH balance cleanser, which is very gentle. It has a little bit of niacinamide in it and evening primrose. Like I told you, I'm menopausal. So the skin tends to get onto the drier side. So if I'm not careful. So evening primrose is great for that. So that's what I use. And then I just use a moisturizer. It has ceramides in it. It has hyaluronic acid. It has vitamin E in it. And it also has niacinamide in it. I use the SkinQ Moisture Balm. Post that, I apply the sunscreen. That's all I do in the daytime. And I've done this for years together, which is my SkinQ Sun Protect Gel because it has a built-in vitamin C. So I don't have to layer a vitamin C and sunscreen. So it's cleansing, moisturizing, sunscreen. But the actives are vitamin C plus the niacinamide and ceramides. In the night, most times it's just the moisturizer, because the moisturizer already has hyaluronic acid built in. There are certain days when my skin does feel a little bit more thirsty or drier or dehydrated, especially when I've been traveling, the flights, etc. I'll add a hyaluronic acid serum. This is consistently my routine, and I use a prescription retinoid just once a week. And the reason is retinols are great, but I'm 48, so I need a prescription strength retinol. So I use that once a week. This is consistently what I do. And I have once a month a medifacial or a photofacial. I'll alternate between the two at the clinic.
What's a photofacial?
When we use light devices or laser devices. So I actually have something called a Q-switch RevLight laser. I have a photofacial with that. It just breaks up any kind of external pigmentation. So that's why it prevents pigmentation from forming on the skin, and it increases the vascularity of the skin. So that's what a photofacial is. A medifacial is like a facial, but it uses science-backed and actives. Like it'll have a glycolic acid peel or a lactic acid peel, and we'll have infusions of like exosomes and polynucleotides in that. So it'll alternate between that. As simple as that, Ryan.
Wow. We all are aging.
Yes.
I've known you for the last decade. So I've also seen that you have advised me to change my skincare routine over 10 years. What is one mistake that maybe I would make, or a lot of people make, when they go from one decade to the next? I remember you saying that collagen doubles down in your 40s and then in 60s. So give us the decade proofed advice.
Got it. Look, I'll just break it down for you. A skin needs something to cleanse. That's your cleanser. Something to nourish. That's your moisturizer. Something to protect, which is your sunscreen. Then it needs something to repair or treat for any skin problem. The first three is pretty much consistent. There can be seasonal variations because in the winter you may get drier, so you may need something heavier. In the summer you may be lighter and oilier, so you may need something a little bit more lighter. That's all. The fourth step, which is your treatment or your repair, changes according to your decade. In your 20s, you may not even need a repair unless you had acne. Then you would use a product for acne-prone skin. So you would look for ingredients like salicylic acid, niacinamide, azelaic acid, and retinol liposomes. Not harsh retinol, but retinol liposomes, because you don't want to break your barrier. Okay, liposomes will deliver it deeper. That's what you would look. But let's get into your 30s to 40s. Here, you start seeing some damage because you didn't have a great skincare routine in your 20s. And also, For women, the hormones start changing, men not so much. So here you may want to start adding something to suppress pigmentation, right? Because 90% of Indian women, 20% of Indian men will get hyperpigmentation in their lifetime. It's a given. The only way to stop it is to use skincare from an early age. So something to keep this pigment suppressed. So you're looking for molecules like licorice, kojic acid, arbutin. You're also looking for like a lactic acid or a glycolic acid for a gentle exfoliation because you want to keep the skin cell turnover going. And then you may add a retinol 1 to 2 times a week only, not a daily, 1 to 2 times depending on your skin, to ensure that the skin comes up, but also the thickening of the skin stays thick. All right, this is it. Now, 40s to your 60s, what happens? You're going to start going towards the drier side because for women, it's now getting towards perimenopause, menopause. And for men also, they'll start doing andropause by their 50s, right? So you're going to move from wherever you are to the drier side. So you're going to add a thicker moisturizer here. So your daytime will be a lighter moisturizer, night will be a thicker, heavier moisturizer. Somewhere along the way into the repair step, you'll add like hyaluronic acid, sodium hyaluronate as molecules to ensure that you're getting sufficient hydration to your skin. Retinol instead of once or twice a week might become 3 times a week. Also along all of this, that's all that changes. But one thing that will change in your 30s and 40s is once a week you'll start having something to exfoliate your skin, right? A AHA or a BHA that people call actives, the acids, but gentle ones at home. And once a month, go in for a medical facial. Simple.
Simple, really simple.
I know. I don't know why people think it's so complex or so hard, and why do they make it so hard?
I think we tend to service our vehicles, we tend to service our homes. We call in people to deep clean our bathrooms and all
Annual
of this.
maintenance contract.
Yeah, and I think on the skin, which is the largest organ, we tend to kind of ignore this largest organ and not say that, okay, I need to have a scheduled maintenance contract for this. We assume that just bathing with water and soap is the annual maintenance contract, which is a daily basis. But there is far more into it.
Or putting your kitchen on your face.
Or putting your kitchen on your face. Thank you for enlightening us on that. Now, I want to stay with the hair because one question that everyone I seem to have with no aggressive skin condition but a light aggressive condition would be like dandruff. So I wanted you to explain to me that dandruff on the scalp, is it skin, is it bacteria, is it fungus, is it oil? And everybody seems to think that an anti-dandruff shampoo is the only way to cure dandruff. What's your take?
Dandruff can be many things, right? It's a very generic term to say dandruff. We call it as scaling on the scalp. So it could be because if your scalp is dry, it could just be the scaling of the skin, and that needs just hydration, moisturization, conditioning, etc. But most times when people say dandruff, they're actually talking about a yeast infection. It's called malassezia. It's actually a yeast infection.
And how do you identify that?
So you go to your dermatologist, have them examine your scalp. They'll do a detailed history and
so
they'll determine.
You look at the dandruff and you're like,
Exactly.
yeah, I know this is a yeast-based dandruff or this is just scalping.
Exactly. That's how it is. And we do a scratch test to just check on it. But that's what it is. And a history of the patient will actually tell you a lot about it. And you need to use antifungal, antibacterial shampoos or anti-yeast shampoos based on what the condition of the scalp is. There's no one fix for all. And once you're prone to it, it's not something that is easily treated itself. It's a chronic condition. So you need to treat it for at least 6 months to ensure that you're getting a curative therapy out of it. And you will need to maintain it for a certain time of period till the dandruff settles. And there's another condition called seborrheic dermatitis that affects our skin, it affects the brow, it affects the scalp also. And again, people think it's dandruff, but again, it's another condition. So there's a lot of reasons for dandruff. And just a simple anti-dandruff shampoo over the counter is the starting point, but it's not the treatment.
So can people get dandruff because of stress and using the wrong shampoos also?
Yes, they can. If you use the wrong product, you're going to cause inflammation. If you cause inflammation, your scalp acts by creating scaling, which people think of as dandruff. And when you're stressed, what happens? You're releasing cortisol, your hormones change, there is an imbalance in your oil. And when your scalp gets oily, all of us have bacteria, fungus, everything sitting on us at all given time. When your skin is healthy, the scalp is also skin, actually, this living part of your hair. So when that also gets a problem, the immune barrier breaks, it allows the infection to happen. That's when you get the dandruff.
So bottom line, meet your dermatologist.
Definitely. Meet your dermatologist. There are aesthetic doctors, aesthetic physicians, surgeons, dermatologists, but meet a doctor. It's not a salon fix. It's a doctor.
Dr. Chytra, with Botox and those natural looking fillers like we've seen on Kim Kardashian, how can one tell the difference between subtle enhancements and going overboard? And are Indian celebrities leaning into these trends too?
I always say that the good work doesn't demand attention. Bad work screams. So when people talk about people's faces and they can notice that something was done, it's not necessarily the best work. The best work is when people just look amazing. And people can't fathom why. They just think you slept well, or you had a great holiday, or you've gone to the gym or something like that. Or they say, oh, you're looking really fresh and relaxed. So the word is to look the best version of yourself. Not to look like someone else, not to look like 2 decades before, but to be the best version of yourself at that time and period. And these injectables, there's a lot of stigma attached to it, unnecessary stigma. Like I tell people, you get the gray hair, you're going to go and color it. How many people are okay letting gray sit there? Very few. And you'll talk about coloring your hair. But when you have a wrinkle on your face, or you have those jowls sitting here, you have these deep sunken eyes, and somebody puts a little bit of filler, does a little bit of Botox to relax you, why is it such a stigma? All you're doing is using a tool to look the best version of yourself. That's all. I mean, you gain a little bit of weight, you go to the gym, you'll work out, you'll get a diet plan, you'll do everything because you want to fit into that dress and you want that dress or that outfit to look perfect. So it's the same with your face. 3 seconds. That's all it takes to make first impression. And the first impression is really how you look, and that's your face and your hair.
Speaking of the face as a first impression, Dr. Chytra, Botox truly becoming the new multivitamin for women, maybe over 30s. Is it something genuinely preventive, or are we giving into Instagram pressure?
It is kind of like a multivitamin, right? Because multivitamins, why do you take it? So that you feel good. Botox also makes you feel good. And the thing with Botox is that it is preventative. In fact, I was part of the first study ever which talked about the preventative benefits of Botox, and how if you start early in micro doses, you can actually prevent lines, wrinkles from coming up. It's not about freezing the face, it's just about having a rested appearance, right? And so Botox is preventative. And it's not only just about lines and wrinkles, like underarm sweating and body odor. It has a great role to play in that. It reduces...
How does Botox help underarm odor?
Yeah, so when you sweat, there's bacteria, it causes the odor. So Botox actually reduces sweating. And when there's reduced sweating, you have no odor. So it's great for underarm odor. It's great for people, some people have that wet palms and you shake hands, or wet feet and they have stinky socks.
So
all of that.
The condition where people genetically are prone to sweat on hyperhidrosis, can that be treated with Botox?
Of course it can. Botox is a known treatment for hyperhidrosis. So we do that. I have a patient who's a teacher, right? And he's a very renowned professor, actually. But you know what? He sweats a lot. And he gets in front of the stage or in front of his students, he starts sweating and he has to keep dabbing it. So we actually Botox him in his forehead so that he doesn't sweat. And he looks fresh. And he has his expressions because he has to be angry at his students. He can still emote. We've not frozen him, but we reduced the sweating.
So Botox also is in the hands of an artist.
It is art. Botox is not just a drug that's injected. It's an art. If you have the right doctor, the results are fabulous. You have the wrong injector, it's disastrous. And Botox is not taught to people in medical schools or derm schools or surgical schools. It's a learned skill that you learn outside because, aesthetics is not a course that we study in medical schools. So you need to make sure that your injector is a physician first and foremost, is a doctor. Second, that they were specifically trained to inject Botox and to inject fillers.
I remember I'd gone to Dubai one time, and at the spa over there, they were talking about Botox. And I said, do you have a doctor in here? So, no, our beauty technicians are trained to give the filler injection. And I was like, that doesn't sound right, especially in the city of Dubai.
It's the city of Dubai. Why? It's all over India. Salons are doing Botox fillers, injectables, PRP, where they're drawing blood, they're giving IV. Everything's very scary, right? Because things can go wrong. Like if you don't put the Botox in the right muscle, you can actually hit the wrong muscle. So your lid could drop or your expressions can change.
And is that permanent?
No, it's temporary because Botox only lasts 4 to 6 months, so it wears off. So that's the good thing.
Ah.
But fillers, if you put it in the wrong area, you can actually cause a trauma to the skin where the circulation reduces, and that can cause ulcer. Similarly, if you're giving an IV and the person puts a bubble in there, you can give them an embolism and they can die with an IV drip. So there's so much disasters. A laser light, if it's not done properly, if it shoots into your eye, it causes blindness because they're level 4. So sadly, we don't have the rules and regulations that are being enforced. There are rules and regulations. It's not enforceable because India is such a vast country right now. And so I always tell this, but I put the onus on my patients too. I'm like, you're literate. You should know better. If you go to a salon or you go to like a mall and then there was a small little shop where they were doing nails and eyebrows and stuff and you went and got your injectables there, why are you complaining if you had a side effect? You should know better. You should also take the responsibility for it.
So I've been hearing a lot about exosomes. What are they and how are they used in your skin treatment?
Exosomes are like our newest it product, right? It's a drug. It's a newest it. And exosomes are nothing but messenger cells. They carry a load which gives a message to your cell. Exosomes are loaded with a lot of growth factors which tell your system that it needs to repair, it needs to heal, it needs to grow, and also anti-inflammatory factors. So it's just delivering a message directly to your cell. It's kind of like having a direct line to God, in many ways for us. So it's fantastic because the basis for most skin and hair conditions is inflammation, and exosomes work on the anti-inflammatory pathway. So it's great for acne, for pigmentation, for helping with scars because we get better skin quality and skin regeneration. For growing hair and thickening hair, it's fantastic. It's good for we were talking about dark circles, all of that, and even rosacea. So anywhere there's inflammation, it's really good. Now, there is quite a lot of data on exosomes and a lot of trials that it's happening. But the quality of exosomes, the source of the exosomes matter, and they're not a beauty product. They are a drug.
So it's a pharmacological product.
It's a pharmacological product. A lot of people will talk about exosomes, there's plant exosomes, fruit exosomes, fly exosomes, etc. So there's a differentiation. Plant, fruit, flowers, etc., botanical exosomes. They're similar, identical, but they're not the true exosomes. The true exosomes are usually derived from either your blood, like platelet, bone marrow, adipose tissue, which is fat, or umbilical cord. And they really are actually introduced into your skin through a microneedling device or into your hair, and that's how they work. It's the new realm of bioregenerative therapy.
In fact, my face we did one treatment with microneedling, and then Pooja put the exosomes after that.
Yeah.
And she said, don't wash your face.
Yes.
Don't wash your face. I'm like, how can I not wash my face?
Just for 8 hours.
Yeah. She says, no, because I finished at 6:37 in the evening. She says, don't wash your face. I'm like, I have to go to sleep. She says, don't wash your face. Go to sleep like that. And then she explained to me that the exosomes will be there and they'll do the rejuvenation after the microneedling. And she was right. The next morning you could see that in the face,
the glow. With exosomes, they're still new. So they are a little bit more pricier than doing like a PRP treatment. But
So PRP is where you take out your own
yeah,
blood and
the
you
vampire
yeah,
facial that everybody talks
you
about.
take out it and you concentrate your platelets, right?
Yeah, we take out the blood and then we separate out the different layers. And there's one layer which is called the buffy coat, which is very strong with growth factors. So typically, if I had to put it in layman's language so people understand better, a good PRP, a good one, can give us about maybe like 100 million growth factors. Exosomes can give us anywhere between 1 to 10 billion growth
Whoa,
factors.
it's that powerful.
It's that powerful.
Wow.
Yeah.
I think I'm booking up an appointment for some exosome treatment.
But not all exosomes are equal, right? You can't compare an apple and a pear. So it's the same thing here. So when a doctor tells you exosomes, also be aware which exosomes you're getting.
So what question do I need to ask the doctor?
You need to ask them what is the source for their exosomes, how many growth factors are there in your exosomes, and is there research and data.
Can you tell us like what are the 4-5 top exosome brands that are used in the world?
I'd love to tell you which exosome to use, but I don't want to because they're drugs, and ideally,
Yeah,
I want you
it's
to
like
see
telling a
doctor.
person, oh, this antibiotic is very good for a cold, and then
Yeah.
everyone goes and gets it themselves.
Exactly. So please talk to your doctor today, and they'll be able to guide you on the best exosome for your skin.
Okay. Any other new treatments that are coming along the way?
Right now, polynucleotides are the big thing. Salmon sperm facials, right?
I heard about that.
Yeah, it used to be vampire facials. Now it's salmon sperm. Why? Because polynucleotides are, again, highly densified growth factors, but they're derived from the sperm of a salmon.
Hmm.
Can you imagine like a salmon fish and then it's sperm and then you take out the growth factors? But that's what it is. So it's actually very regenerating and rejuvenating to the skin. Great for scars, great for people with problematic skin, for open pores, etc. And it's really good for just your quarterly maintenance of your skin. And again, you do a microneedling and you deliver the product, apply it after that. And it's fantastic. So vampire facials out, salmon sperm facial in.
Staying with that, there's a popular belief that we should avoid applying anything on our skin that we wouldn't be willing to eat. Now, according to you, how true is this concept?
What you eat is to be inside your body. It's not to be applied on the surface, because your gut can absorb. It'll filter. What's toxic gets pooped out, and what's nutrient gets absorbed. Your skin doesn't have that filtration mechanism.
That's a very interesting point.
Yes.
Because the gut can filter, but the skin can't.
Exactly. The skin can't. And also, what people don't understand is, like I said, you have the barrier. That's why most things can't get through. It has something called receptors, your skin. So what it recognizes as being helpful, it'll absorb, like actives. Some of the actives it absorbs, some things in essential oils get absorbed into your skin. So because there is a receptor for that. The rest of it, your skin starts clogging itself because it doesn't know what to do with it. So just because it's great to eat apple, like apple a day, keeps the doctor away, but if your doctor's good looking, keep the apple away.
And that's a new one. That's a nice one.
But, just because it's good doesn't mean you make a mash of it and put it on your skin, right? It doesn't work that way. You have to deliver whatever needs to help your skin to the deeper part of your skin. Skin is 3 things. You have the upper layer, the middle layer, and then the bottom layer, kind of. The upper layer itself has about another 5 layers. In those 5 layers, each of them have 25 to 30 layers. Think of the complexity. We're talking about 150 different layers in the upper part itself, literally, right? So it has to penetrate all of that and then go to the second layer, which is your living part. On the surface, it's all dead skin. It has to go to the living part. So for that, you have to deliver that active to the living component for it to change your skin or to repair or heal or whatever it is that you want to do. It's not going to happen with what you're eating.
Before I get to the rapid fire, I have some few questions that have been asked in my counseling room to me. Do people living, let's say, in Goa or Chennai versus people living in Bangalore where the humidity is lower have a differentiation of the attack of the humidity, not the attack of humidity, but the moisture content in the room has an effect on a person's skin in these two cities?
The moisture content has a big role, and UV radiation. These are the two things that we have to talk about. Somebody in Goa or somebody, let's say in the northeast in the mountain terrain areas, are exposed to more UV radiation than somebody in Bangalore is inside inland. The reason is that when you're on the beach, the sand and the ocean reflects more, and when you're in the mountain, the sunlight is closer to you, so you get more, and if you're near the snow, that reflects more. So there's a lot of UV radiation, and 90% of the damage that happens to our skin is from UV radiation. The rest of it is your genetics, your stress, your bad night nutrition, your poor lifestyle. What about the humidity? That's very important. Look, having humidity, having more moisture in the air is always good, because the air is always trying to get moisturized, not our skin, but the air. So if you are the person with more moisture in a room, you're losing the moisture. That's why we say if you're sitting in air-conditioned environments, always have humidifiers, or have a big bowl of water. Like I tell my corporate clients all the time, at your work desk, keep a bowl of water next to you. And you'll see that bowl of water evaporates by the end of the day, because all offices are centrally air-conditioned. And if you're in colder climates, then it's the heating. So that's why you need to have a bowl of water sitting next to you wherever you are if you don't have a humidifier. Otherwise, the water from your skin is the one that's going into the ambient.
Very valid point. Dr. Chytra, before I let you go today, some quick questions of rapid fire. Okay?
Done, let's go.
What's the sunscreen mistake most people are making daily?
Not using sunscreen. Really, you'll be surprised how many people don't actually use sunscreen even though we talk about it. So that's one. The number two is not applying it at least 2 times a day. Ideally, we want it to be reapplied every 3 hours, but 2 times, at morning and at lunchtime. Third, not investing into a good sunscreen.
Top 5 do-it-yourself skincare hacks that do not work at all but people still use.
Toothpaste. They think that if they have acne that they can get away using toothpaste. That's one. Then the newest trend, I don't know why, bicarbonate soda. Oh my God, that's horrible. Third, putting everything in your kitchen shelf on yourself, right? Like garlic paste, onion paste. I don't know what that has to do with anything. So that's how many?
3.
3? Okay. Then the other one is just anything. If anything is a problem, put ghee on it, or put butter on it, or put malai on it. I don't understand the funda behind any of this. And fourth, lemon juice. Fifth, I think, lemon juice. Everybody wants to use lemon juice for everything. And I think it's going to bleach their skin. But it just photosensitizes their skin, and they're going to eventually get pigmentation.
Top 5 tips for dark skin tones.
Invest into a sunscreen from an early age. A child after 6 months of age needs to start using sunscreen if they're going to spend a lot of time outside in the sun. Your kid is playing sports, sunscreen. That's the first. Second, avoid harsh exfoliants, no scrubs, because the microbeads in the scrubs will cause scratches, which will cause inflammation, leads to pigmentation. Third, don't overuse actives, because actives again cause inflammation and damage. Any inflammation in dark skin, pigmentation. Fourth, make sure you protect your skin barrier. That's most critical, because if your skin is hydrated, it'll repair yourself. Fifth, make sure that you're on point with your nutrition. Vitamin B, D, iron, critical.
Razor, waxing, or these new organic paste and scrub, what's the safest and most effective?
Neither. Laser hair removal. Today is the era of laser hair reduction, which is permanent hair reduction. So you can have your hair gone permanently if you use laser hair reduction for body hair and facial hair. But let's say that if you're a guy and you want to keep your beard, because one day you may want to get a beard, then razor, but wet razor. So it has to be a wet shave.
Oily, dry, or combination skin, what are the quick do's and don'ts for each type?
Okay, oily skin, use at least 3 times a week a salicylic cleanser to just get the oil out, not necessarily daily, and use a oil-free moisturizer. That's all you need to do. And once a week, use a clay mask with like salicylic acid, niacinamide, vitamin C, etc. built in to degrease that skin. Next is the dry skin. Dry skin is all about hydration and moisturization. So make sure that you always use a serum plus a moisturizer on a daily basis. In the winter time, go into a heavier moisturizer, which is more creamy, and ensure you have more oil. Like, I think you will be the right person, nuts, seeds, etc. in your diet. Combination skin, you have to have two types of skincare. One for the T-zone, which tends to be like the oilier, and the periphery, which tends to be normal to dry. So you're going to have to focus on doing two types of skincare, one for the T-zone and one for this. There's no universal there. But as you get older, it's going to normalize. And for all skin types, if you're over 25, once a month, get a cleanup, or at least once in 6 weeks. For oily skin, it's really a skin that gets clogged easily. So don't use anything too heavy texture-wise on that skin, and you don't want to experiment too much. Oily skin is not forgiving. It'll just break out like crazy. Dry skin, you want to go softer with your actives. So don'ts are overusing of actives. And combination skin, again, like I said, it's a combination, so you have to play with it. Don't use just one product for the entire face.
Or like Ryan Fernando, don't be lazy and use one product for the entire face.
You do not say that to your dermatologist, Ryan Fernando.
I am so lazy. It's like, oh God, there's this zone. Dr. Chytra said to do this. Dr. Chytra said to do that.
But I only gave you very few products.
Yeah, I know, but I think we men tend to be much more lazy about it. Like,
that's because you have testosterone. That's why. And the reason is also because you shave. And because you shave every day, that's an exfoliation that keeps your skin cell renewal up. That's why men's skin don't age as fast as women's skin.
All the guys who have beards start shaving. And I tend to get a lot of chapped lips. What's there beyond lip balm?
Beyond lip balm is ceramides. So using ceramides in your lip balm with petrolatum jelly is good. So first you put a ceramide moisturizer, then you put your lip balm or petrolatum jelly on top, because you tend to lick your lip.
Do you have any product?
Yes, the moisture balm from SkinQ. Just put that and then put your...
I'm getting it today.
Yeah, and then just put your petrolatum jelly on top. That's it. And avoid lip licking. The commonest cause for this dryness is because one is licking their lips too often. And third, Ryan, you need more oil and fat in your diet.
Can improving mental health lead to better skin? Your advice on this?
150% yes. Look good, feel good, right? So it works both ways. And if you're mentally happy and at peace, your hormones are in equilibrium. When that's in equilibrium, your skin is able to function the way it needs to, so the skin will glow.
I walk into your clinic, 3 best habits for both men and women for happy skin.
A consistent skincare routine, work on your diet, and third, try and see how you can improve upon your stress and lifestyle.
If someone's on a budget, absolute must-have products in skincare.
Sunscreen. If you are on a budget, just that sunscreen. Invest only into that sunscreen. Wash your face with water. I'm okay. Unless you wear makeup. Then obviously you have the budget for makeup. Then you can also invest into a cleanser. And then a skin barrier cream. That's all. You only need these 3 things. And at least once in a quarter, go to a skin doctor and get a medical facial done. You do need to invest into that. And it's not that expensive, Ryan. Like if you think about it, a good sunscreen is probably around 1,000 rupees, all right? And a good evidence-backed moisturizer should be around 800 to 1,000. A cleanser should be maybe 500. That's 2,500 rupees there. A decent entry-level Medifacial can start at about 3,000 rupees once in a quarter, which is 1,000 a month. So it's not really expensive.
And the look is $1 million.
And the look is $1 billion. And when you're on a budget, like it's okay, save up, but invest into good skincare. Something is better than nothing for sunscreen, but for your barrier cream, invest into a good barrier cream. You need ceramides. You may need some squalene if you're on the drier side. You need hyaluronic acid. Then you need a good base and evidence behind that. So just look for these ingredients and niacinamide for Indian skin.
Doc, today Netflix is on a battle with us.
Yes.
And everyone's sleeping lesser. I know with the exercise wearable data that my clients give me, it shows that recovery is poor because sleep is poor. And sine wave sleep, which is deep sleep, is very low. How important is sleep for skin rejuvenation?
Extremely important. Like I said, equilibrium, right? For your body, for your skin to recover also, you need to get that amount of sleep that is required for your body recovery. When your body is recovering, your skin automatically is recovering. It's not piecemeal approach. It's not like skin will only recover in 2 hours, next will be your heart, next will be your brain, next will be your lungs. All of it gets into a synchrony with our circadian rhythm and with our deep sleep cycle. Even like how your lymphatics work, right? The same way lymphatics in our brain work. So it's everything in equilibrium. So if somebody loses sleep, and let's say you were Netflixing or whatever you were doing, instead of what your body needs, that 7 to 8 hours of sleep, you get that 1 hour less of sleep. It literally takes 24 hours of sleep to catch up with that 1 hour loss. And the world we are in, it's a rat race. None of us are going to have that luxury of that extra 24 hours of sleeping time.
And there's this one more point which you can tell all your clients who come in, that if you lose 2 hours of sleep, so you're supposed to sleep about 8 hours and you do a 6 hour sleep, the next day your calorie requirement, because your heart rate goes up higher, adrenaline goes up higher, cortisol goes through the roof, the requirement is 900 calories more. So sugar cravings and binge eating happens more the day after you've slept lesser.
True, which means more inflammation.
Which means bad skin.
Bad skin and breakouts. Always.
Sleep better, India, because that's what is needed. That's the best skincare regime you could start with. And it costs you no money. And set the sleep time for you to go to sleep. Don't set the alarm to get up. Get to bed and get 8 hours of sleep is the prescription from the nutritionist and Dr. Chytra.
Also, try to go to bed at the same time. That's just as important. It's not just 8 hours of sleep. It's consistently going to bed at the same time so that your body gets its body clock right. And then it becomes automized.
I think we should think of every organ in the human body as a factory.
Yes.
And it has a time clock of check in and check out.
Exactly.
And the skin needs to check in for rejuvenation around 10 o'clock at night and get its full 8 hours to get all the layers done, as does the liver, as does the heart, as does the gut.
The
brain, yeah. There was this article the other day saying that we actually eat our brain with lesser hours of sleep.
It's true. And like I told you, the lymphatics, right? It's like the lymphatic system of the brain. And if you don't get enough sleep, the lymphatics don't click in. So then it's not able to clean the toxins of that day. So they become like little plaques in there. And that's how you get more Alzheimer's, dementia, etc. coming up.
So Dr. Chytra, any questions to ask your nutritionist?
100%. So Ryan, we talked about so many things, right? One of the things I tell my patients is protein intake. And that protein is also very critical to our nutrition along with all of those vitamins. So what can you tell people about protein? Because some of them are like, oh, I'm doing whey. Some of them are like, I'm doing iso whey. Then some are like, oh, I get enough in my diet, but I'm a vegetarian. I'm eating like, soy and this. So give me something about protein.
So the first thing that I would tell a person in today's day and age, because they're seeing you, is we know that inflammation is a huge problem. And I know eating the wrong food could cause inflammation. So if money is not an issue, I'd ask them to do a food intolerance blood test to see which are the foods which are affecting them. So if dairy is allergic, then you don't do whey protein. If soy is allergic, you don't do soy protein. Green pea protein, I'm allergic to green pea, so I can't do green pea isolate as a protein supplement. But overall, I'm seeing that collagen is coming to be the most hypo and the best for people. So starting with protein requirement could be natural sources first. And how you do that is 1 gram per kg body weight for maintenance. If you're training, 1.2 to 1.5 grams per kg body weight is the norm. Now, we in India have been traditionally protein less, and I don't think that has been an issue. And there's a lot of push to people in this part of the world taking more protein. What I say is when a patient comes to me is, do 3 months with 1 gram per kg body weight, whatever your sources, whether nutritional supplement or diet or both. And then another 3 months, you do 1.2 to 1.5 grams. Observe your skin. It's the greatest organ of reaction.
Yes.
If your muscle and skin looks better, continue. Look at your liver and kidney enzymes at the end of those 90 days? Do you have a higher uric acid?
Yes.
Do your inflammatory markers like C-reactive protein and ESR go up? We've had patients where it does go up. When I, as a sports nutritionist, want to increase the protein because they are doing CrossFit or some heavy training, but that has been detrimental. So no one size in diet fits all. So even the protein supplements, if being prescribed, get in touch with a good nutritionist, evaluate your muscle and fat percentage, evaluate your energy expenditure, then plan your protein load accordingly. And many times, I would say 8 out of 10, most people don't need a protein supplement.
Let me ask you this. For us, like we see a lot of our procedures getting done in salons and stuff like that by unqualified people nowadays. For you, a lot of my patients will actually tell me that their gym trainer put them on a protein supplement, and they put them on, sometimes they would not knowingly actually be on anabolic steroids too. So what do you have to say to this?
In today's day and age, so what I believe in today's day and age is that everyone's looking for that quick fix pill, right? And when you go and work out, it's hard work. Obviously, you are surrounded by this person 1 hour a day, almost 20 days a month. Even your patient doesn't see you that often. They see me once a month or twice a month. So the psychological impression by that person is much more powerful because of proximity. So you tend to believe such a person. What I feel is people need to get smarter.
Yes.
You go to the physiotherapist, you ask them about physiotherapy advice. You go to the trainer, you ask them about exercise. You go to the nutritionist, you don't ask them about medicines, you ask them about diet and nutrition. You go to the doctor, you ask the doctor about how treatment or medication should be done. So each person is an expert in their domain. Unfortunately, what's happened in today's day and age, the influence from the internet is giving people a democratic approach to decision making, which was not there in the past. And that brought about a better control on the side effects.
Yeah.
In today's day and age, if a gym trainer gives you anabolic steroid, you're just looking at the end result. You're not looking at the consequences of that. And Dr. Chytra, I know so many doctors who work out, and I know almost no doctors take anabolic steroids. I'm Ryan Fernando. I'm a skinny guy. I know everything that is there to know about taking steroids. Why didn't I take a shot 20 years ago and continue it and bulk up like Arnold Schwarzenegger? Because when you have medical, scientific advice inside of you, being advised by a doctor, you know that this is detrimental to your health.
Exactly. Yeah, well put, Ryan. I think, you said democratic and smart. Like, I put the onus on my patients too. And I say that if you had bad advice, why did you even take the advice? You should also be smart about knowing that who you should take the advice from. The next question I have for you is, I see this quite often, right? Acne. When people are having acne and they're working out and, consistently and stuff like that, a lot of times they get onto the whey protein. And whey protein in a lot of people does trigger acne and hair thinning. So can you comment on that?
Now, 20 years later, with the Qua Nutrition clinics where we practice with over 200 dietitians, we've got data, right? And we have found out that even something like vitamin C could be allergic to that one single individual. Whey protein has been pushed by a commercial narrative because the cheese industry was dumping whey in the drain. They did do research on it, but I must tell you that whey has the best biological advantage, highest protein digestibility, corrected amino acid score. So it is a powerhouse protein, but no one size fits all. What the media and influencers are trying to do is trying to push this narrative. And please understand that unlike the drug and pharmacology industry that's regulated, the food and the nutraceuticals industry is not regulated. So tomorrow, even my housekeeping and somebody else in our organization who has a lot of money could start a food brand.
Yeah. Very easy. Even nutraceuticals, because we have a formulation company, I get so many queries asking me we want to start a nutraceutical brand. How much money do we need? Can you give us these?
And so what happens is, I think because of that process, the people who launch products don't have qualification responsibility, say like a doctor, wherein when they build the product, there's an ethical responsibility too. It's only a business responsibility. So they're pushing the whey protein narrative.
Yeah.
Now, it doesn't help that your trainer also is brought up on whey protein. And then people will take excess amount of it. I'm not saying whey protein is bad. What I'm saying is before you take a protein supplement, get yourself from a food intolerance perspective tested. I'm allergic, dairy-wise, to every possible milk except camel milk.
Really?
So if you can make me a whey protein from camel milk, I can consume that. But nobody told my trainer at 19 years of age when I was powerlifting on the college weightlifting team that I was the skinny guy. I was taking tubs of whey protein those days. And I had all of these massive pimples with pus and everything. And I thought it was hormones.
Yeah.
And it was not. It was just the wrong selection of food. That's one of the reasons I became a nutritionist, because nobody took the time to tell me that, boss, what you're trying to do, maybe what the medical, we were born in the time when we didn't have internet.
No. We didn't.
I went to the library and I had to look through the scorecard like that and find that book, then go to that shelf,
Same.
check it out, and then get angry that somebody didn't put the book back there and hunt the whole library for that medical textbook on protein.
Yeah.
So having said this, I think whey is over-advertised. It's a great product, but in the hands of a great doctor or nutritionist can be prescribed for getting you the best goals. And if it doesn't agree with you, there are 10 other food nutritional supplements that you could take.
Let's talk a little bit about GLP agonists, right? It's now become the it thing, right? Like trending. And I was just in the US, lecturing in the US at a scale conference, which is a large 2,000 plus doctors across the US, everything. And one of the things I learned there is that 30% of America is using GLP agonists today. So if you think about that, that's a huge population base. And from the skin side, I see the changes, right? If they don't take care of themselves, they get this sagging, and then they get the appearance of cellulite, stretch marks and stuff. So we actually now have a subscription package for patients who are on GLP agonists to keep that skin tight so it doesn't sag. But from a nutritional perspective, can you talk about it? Because their appetite shrinks, and I see them getting insane amount of hair fall, telogen effluvium. So can you talk about the nutrition aspect for somebody who's on GLP agonist?
So two parts to this coin, and it might be a little long over here. The first part is that most of medicine today has understood that people are unwilling to take care of their obesity by exercising, diet,
We're
and
lazy.
sleep.
We want a quick
Right?
fix.
So the lazy part of is there, and we want a quick fix. So the first attempt should be, unless you're morbidly obese, which is above 35,
Or there's a medical
or there's a
indication.
medical or genetic indication, then the GLPs antagonists are thumbs up, prescription by doctor only. But doctors also, I wish to caution them on this, is that you've got to encourage your patient to at least once try diet and exercise before starting them on this. And here's my logic. You see, once they get onto this, you have not convinced them to start working out or taking care of their nutrition.
Oh, that's very bad.
So once you put them on a medicine, they don't have the psychological discipline to invest in nutrition and exercise and any other treatments that are aesthetically required. So you now have a cascade effect where you have lost weight, your comorbidities and all-cause morbidities are reduced, which is, I'm very happy you're not going to die from a heart attack, BP or anything, but you're still in that couch potato mode and a drug is fixing you. So the maintenance requirement is that there were a few studies conducted on probiotics regulating the GLP. Things like inulin,
Yeah.
L-carnitine, fructooligosaccharides, which form part of the prebiotic and fat-burning molecules, chromium picolinate.
Yes.
All of these can be done and can give a lot of people promise before they step into the drug realm. So as a nutritionist, I always want to convince people that before you get onto a drug, I want to convince doctors, before you put people onto a drug, at least let us try with a client for 3 to 6 months. But if the doctor or the patient says to me, I'm lazy and I don't wish to do any of this, then I believe the drug is the savior because it's better than dying from a heart attack or a stroke. Once you get into that zone and you've lost weight, fingers crossed, I'm thinking people will pay to take care of themselves, which is the aesthetics.
You're right. I think that's a very poignant point, right? Quality over quantity. That's very important. Now, my last question to you, because we talk about collagen, right? And we are always stimulating collagen. And now we're talking about collagen supplement, and there's enough data that collagen supplements do help. But it really, if you break it down, it's amino acids at the end of the day. But have you done studies on collagen? India being a vegetarian primarily country, and I always say that marine collagen is the best form of collagen. So what is your take on this?
So like you said, you asked a very nice question. And for many, many years, I've been giving my wife collagen because I believe as a nutritionist, it's good. In the olden days, we did bone broth soup.
Yeah.
Right? So we
Or
did
paya.
or paya soup or chicken broth soup. Or we are from Goa and we had soup. And my granny would make the fish stock and use the soup that way. So here's the thing, okay? Collagen supplements, whether type 1, type 2 or type 3, are beneficial. The target is skin, joints, and other soft tissue. Each one to his own right. There is research in each one of them. As a nutritionist, I am not looking at collagen from a pharmacological impact of a tablet dose. I'm looking at a higher dose of 9 to 10 grams of collagen. From gelatin, we get the collagen.
Yeah.
So, given an option between, let's say, an average lifestyle person taking whey protein who doesn't work out and taking collagen, I would ask them to take collagen.
Yeah, I agree with you on that.
Now, marine collagen becomes the preferred choice in our nation because bovine collagen is, from a spiritual and a cultural point of view, a no-no. So, marine collagen comes in. Now, people need to understand that when we eat any protein, we don't absorb protein into the body.
Yeah.
It is digested and broken down by your enzymes and acids into amino acids.
Yes.
So if your digestive system is not good, first correct that. But once you start taking a nutrition from food, which has protein in it, which could be fish, which could be any type of protein. In this case, if you're taking marine collagen and you're kind of hacking it by taking a supplement, it will hit your body and break down to the amino acids. You're looking for proline, hydroxyproline, and glycine.
Yes.
And these come in natural foods also. But what I believe is that when you fortify a food and you give it as a one shot in a soup or a tea or coffee, like I have a Core Nutrition collagen, which is a marine collagen. For many years, I've always tried to look at this combination of amino acids coming in from the diet. And yes, there have been some great products out there from Japan which have marine collagen.
Yes.
And I used to prescribe that to my family, my mother, my mother-in-law. In fact, I remember convincing my Tambram mother-in-law that she has to take marine collagen. And I'm like, this is medicine. And she's a gynecologist. So as a doctor, she understands that at a certain point, you will need therapeutic help.
That's true.
And she saw a lot of improvement in her joints and bones. Not to mention skin began to actually soften up. Elasticity improved, fine. I would say that she herself identified that, you know what, my wrinkles are looking better.
Yeah.
And for an 75, 80-year-old woman to say that, it's really good. But coming back to it, so when I design marine collagen, the world needs to understand, okay? You can get collagen, and Dr. Chytra, your collagen and my collagen are the same.
Yeah,
They're either sourced from bovine, from fish, or from any sort of animal bones.
Yeah.
Right? What we're looking for is low heavy metals in them. We're looking for quality of extraction. But in today's world, what I feel is the difference between a lot of things is people are trying to make tasty products.
Yeah.
So they're putting
flavors,
artificial flavor, artificial sugar, artificial sweeteners, preservatives, and emulsifiers.
The worst.
So as a nutritionist, I thought to myself, the manufacturer says, we need something that doesn't spoil. So you need to put preservative. And I'm like, listen, anyone who buys a product is going to finish it in 1 month. I need 3 months shelf life. Give me a packaging that seals out moisture.
Yeah.
Now, most manufacturers don't do that because packaging, when becomes heavy, courier costs go up.
Exactly.
So it's all about the saving of the money to give a tastier, more economical product. And I tell people, don't buy or consume or put anything into your body or onto your body that's cheap.
Yes. Yeah, exactly. How are you going to get high quality products for cheapest? You can't. And people don't understand that same way, right? When I talk to them about marine collagen, they're like, oh, I'm taking collagen. And, I only spent 300 rupees on my collagen. I'm like, then it's not really collagen, and stuff. And same way with skincare. We have 6 levels to a quality of an ingredient. And level 1 is so expensive. And most people use level 6 because at the end of the day, no one's going to certify your quality.
So I think that's where people like you and me need to jam more often, because I think at the end of the day, when you and I launch products, it's more about the integrity of our name.
Yes.
Because you and I are going to do this till we're 100 years of age. Hopefully, if the good Lord wills it.
And we're doing it because we saw that there's a need for it, right? I created skincare because I couldn't find the right skincare for myself. And I was like, gosh, let me create this. And for my patients, I didn't want them to use 10 things. You don't have the time to put 2 things on your face after I made it so easy. Imagine if I gave you 6 things.
But I love Dermabright, your product of
Thank
Dermabright.
you.
What is the active ingredient inside Dermabright?
It has 12 actives.
Because whenever I use Dermabright, in fact, I used it last night before I'm like, oh, I'm meeting Dr. Chytra tomorrow. I better put Dermabright on my skin. So, but I know you'll tell me like one day is not good enough. You need to be consistent.
I mean, yeah, you have to be consistent. But, it's easier for me to tell. It's hard for people to get so disciplined all the time. But the thing is, I always say at least something is better than nothing.
True.
In this,
true.
when you're using high quality products.
So, Dr. Chytra, I know where I can find you. You're just a phone call away from me. But for millions who watch in and check in, how can they reach out to you?
So I'm the founder of Cosmoderma Clinics. That's where I practice. So you can find me at Cosmoderma Clinic, and I'm based in Bangalore. So I'm based at Cosmoderma Lux at Vittal Malya Road. But yeah, and you can find me online too. Cosmoderma.com. That's Cosmoderma with a K. And also my Instagram profile, which is at the rate of dr.chytra, Chytra.
And I promise to put the link in the description below so you can get in touch with this beautiful celebrity dermatologist. I really hope you enjoyed this episode. My job is to try and demystify the world of taking care of your health. Dr. Chytra, thank you so much for coming in today and enlightening us about this beautiful, largest organ that we own called the skin.
Thank you so much, Ryan, for having me on your show.
God bless.
You too.
I don't know about you, but I've learned so much from this episode with Dr. Chytra, including getting a little bit of bashing from saying that I don't take enough care of my skin, and she happens to be my skin doctor. You see, we humans are lazy people. But what I learned from exosomes and lasers to sunscreen myths and everything in between, what really stuck with me is her simple mantra: cleanser, moisturizer, and sunscreen, the holy trinity of healthy skin. I hope this episode inspires you to invest in your skin today. Breakouts, pigmentation, or scars, totally normal. But ignoring your skin, not an option. It's the first thing people notice when you walk in. So give it the care it deserves and let it speak for you. And here's the exciting part. I've written down all the action points and key takeaways from this podcast. But I'll release the PDF only after we get to 1,000 comments telling me your favorite part of this episode over the next 2 weeks. So don't forget to like, share, subscribe, and comment what was your favorite part in this episode.